Hi, I'm Danielle Larozignol, Manager of Professional Support Staff for DECYP. We've got a range of allied health professionals working within DECYP across a whole range of different teams across our organisation.
I am an acting practice leader at Strong Families Safe Kids Advice and Referral Line. My role is to support, encourage and represent child and safety wellbeing workers at our service. I think for me it's around supporting my team with best practice outcomes, utilising those wellbeing frameworks and just supporting them to get the best outcomes for children and young people and their families. So since the transition to DECYP, we have shared values now. We're under the one agency. So we work really collaboratively with other stakeholders within the service to ensure children and young people are safe, well and learning. We can have those real honest conversations with other stakeholders, whether that be social workers, teachers, and we have those conversations to achieve the best outcomes for children.
I'm a school social worker. I work at 2 schools, 1 high school and 1 primary school. I really love working with children, young people and their families to help them have access to their education. We work really collaboratively with the school psychologists, school nurses, speech pathologists, support teachers and all of the other teaching staff at schools, as well as alongside lots of external agencies that we utilise to bring in support for kids and families. Best case scenario is that we've got happy and engaged young people that are working together to make sure that they are having all their needs met across the domains of their lives. I like the opportunity to support families to work alongside schools in order to build their confidence and capacity.
I'm the English as an additional language social worker for the north of the state. And Emma and myself work to support schools in building cultural curiosity and capacity and responsiveness for their families. I really enjoy seeing the connection, seeing that relationship building between schools and our families, so really being able to go in and support the school and how they can better communicate. This role really wouldn't work without teamwork. It takes a village, and a lot of the families that we're working with come from communities or cultures where it is that village that's supporting them. So we want to make that happen as well. We really need to be not just the EL social worker, but connecting with the school classroom teacher, as well as our teachers and the family, and linking them to the community.
I'm the Director of Clinical Services, which is a new position and a new team. Our role is to sit across community and custodial youth justice to provide an advice and direction around international and national best practice, evidence-based practice in terms of assessments, interventions to use with young people who have offended. What gives me the most satisfaction is talking to the practitioners in the community and in the detention centre about success stories they've had working with young people to assist the young people to connect and reconnect with family, community and their broader systems, so that when their time with youth justice is finished, they've got those connections maintained to help provide support to the young person.
I'm a social worker with the Back on Track team in Launceston. What I love the most about my job is working closely with young people and supporting them to make decisions that affect their lives. Time flies when you're having fun. Well, that's what we try to focus on with young people, to choose a pathway that they are passionate about. Best case scenario is that a young person becomes more connected with community, their family, their peer group, school, employment or some type of training. I love working in a multidisciplinary team. What that brings is a whole wealth of different ideas, ways of looking at things, frameworks, bringing those ideas and those skills together to view a young person's situation in a more holistic way.
I'm manager with the Tasmanian Autism Diagnostic Service, and I work with a small team of allied health professionals who undertake autism assessment and diagnosis across the state. I really enjoy working with complex situations and really subtle presentations. I love watching clinicians' confidence grow as they do more of the work, and I really love it when I see kids and young people understand what's going on for them and I suppose have a sense of direction about where they can go to next. Many of the families that we work with come from a wide range of backgrounds, and their circumstances, they aren't always straightforward. So I suppose what I love doing is working in conjunction with other people so we can facilitate the best outcome for kids and young people.
I'm a school psychologist. The big component of that is assisting students with their mental health, and that is essentially therapy for different things like depression, anxiety, and then consulting with parents and teachers to make sure that we can assist with whatever questions they have. I think what I really love about my role is the variety. I love that I get to travel across the state. I love the different variety of kids that we're working with and families, seeing different schools and meeting different people and teachers and different support staff in each school, and I think that variety is a big thing for me. Yeah, I think there's a lot of benefits to the multidisciplinary approach in DECYP. In liaising with different professional support staff, it means that the students can get the best support they can get, and that families are able to access all that they need going forward, so it's really helpful.
I am one of the practice leaders at Strong Families Safe Kids Advice and Referral Line. I support a team of child safety and wellbeing workers who are on the front line answering the phone calls and working directly with families. My role is to support them essentially through consultation and providing wellbeing support and the tools and resources they need to really excel in their role. I enjoy the fast-paced environment and that you really can't plan your day. I love that every day is different and that there are challenges. That's really what brings me back to work, as well as the rewarding, conversations and relationships that you get to build. I think the best case outcome would be that they feel heard, that their interaction with us is positive and is something that they might be likely to give us a call in the future as well, but also that they can get the support that they need and that children are being cared for and well looked after. Since becoming DECYP, I've certainly found it really wonderful that we have the shared values now that we can work towards, particularly in care team meetings, or whether it be that initial call that comes into the advice and referral line. I've also found it incredible to learn from others. We all have such great ideas, and knowing that we have a shared end goal that we can work towards and come together and collaborate and put all our ideas on the table.
I'm a school health nurse located in a couple of different schools at Southern Support School and at Newtown Primary School. I love that I get to work with children every day, and also how varied the role is. I get to do something different every single day. So we provide health education and health promotion to students and their families from a school-based setting to help give students the information so that they can make the best informed decisions for themselves.
I'm a speech language pathologist, so I work with children in the education system. I provide assessments and therapy to children with communication difficulties, and I also work with teachers, parents, teacher assistants to help support them with strategies to support the children. I love working with the children and seeing them reach their goals. It's really satisfying to watch a child gain confidence in their communication, both with me and the wider school community. I work really closely with other support staff within the school, so social workers, psychologists, support teachers, to work out where that child is at one point in time, and to prioritise what's going to be the best way to support that child at that point in time and put those supports in place.